Many patients sometimes leave a doctor's office feeling awkward, ignored, or even doubting their own perceptions due to their age. For women over 60, the following information can fundamentally change their approach to their health and potentially even save their lives. This material will examine 5 questions asked by medical professionals that may seem harmless at first glance, but can, in fact, conceal dangerous biases, manipulation, or outright ageism. From subtle checks on mental acuity to condescending judgments about a patient's future, these questions can influence the course of treatment in ways one might not suspect. It is crucial to read to the end, as the 5th question appears with alarming frequency, and knowing how to answer it correctly can protect a patient's independence and dignity at the most critical moment. 1. Are you sure you want to know the results? The question, "Are you sure you want to know the results?" often echoes in the quiet, almost sterile atmosphere of a doctor's office. It typically follows a screening test, blood work, or scan, as the doctor pauses, perhaps sighs heavily, or offers a sympathetic smile before uttering these words. At first glance, such a phrase might be perceived as a gesture of care, a gentle attempt to shield someone from potentially bad news. However, upon deeper examination, it becomes clear that this question is often less about the patient's emotional well-being and more about the healthcare provider's own discomfort, lack of time, or even an unwillingness to engage in a complex and lengthy discussion. Explaining medical results, especially when they are intricate or indicate potentially serious health issues, is a challenging task. This process demands significant time, considerable patience, and a genuine commitment to maximum clarity from a doctor. The specialist must translate specific medical jargon into understandable language, anticipate potential patient questions, and help them grasp all the implications of the results. Such work requires not only deep medical knowledge, but also developed compassion and high emotional intelligence, qualities that, unfortunately, not every doctor prioritizes or has the energy for during a demanding workday. Some healthcare professionals use this question as a subtle, almost imperceptible tactic to discourage a patient from delving too deeply into their condition. It's a way to downplay the significance of abnormal results or nudge someone into a state of blissful ignorance. After all, if the patient doesn't insist on details, the doctor won't have to spend 20 minutes explaining elevated liver enzymes or a suspicious shadow on an X-ray. However, there's a harsh and undeniable truth. Ignorance is not bliss when it comes to one's health. Early information can be the boundary between timely problem detection, while it's still manageable, and allowing it to escalate into something potentially life-threatening. An illustration of this is the story of Janet, a 68-year-old retired teacher known for her warm laugh and love of knitting. She consulted a specialist, complaining of persistent fatigue that had steadily worsened over several months. Her previous doctor ordered the necessary blood tests, but then dismissed her concerns, casually remarking, "It's probably fine. Do you even want the full rundown?" Trusting the doctor's expertise, Janet shook her head and left the office, feeling reassured but still exhausted. 6 months later, she sought a second opinion from another specialist. Upon re-examining the same blood work, what was seen caused deep alarm. Her iron levels were dangerously low. Her platelet count had been steadily declining, and other troubling signs pointed to a possible bone marrow condition. These were early warning signals that could have been addressed much sooner with timely and proper intervention. Instead, because her previous doctor didn't take the time to explain the results, or, worse, actively discouraged her from detailed inquiry, Janet's condition progressed. The problem was caught in time, but the delay cost her months of unnecessary suffering and a significantly more complex treatment plan. Such a case, unfortunately, is not isolated. Studies convincingly demonstrate that misunderstanding or intentional withholding of information between medical professionals and their patients contributes to diagnostic delays in up to 20% of cases, which is especially critical for serious conditions like cancer or autoimmune diseases. Consequently, if a treating physician hesitates to provide test results or acts as if they're doing the patient a favor by sparing them excessive details, the patient has every right to feel justified suspicion. A doctor's direct duty is to inform the patient, not to conceal the truth from them. The patient is not asking for a privilege. They're demanding what is rightfully theirs. The moment such a question is posed, respond firmly yet politely. Yes, I wish to know every detail. Please explain the results and their significance for my health. It's advisable to bring a notebook for notes or, with the doctor's permission and in accordance with the law, record the conversation. It's important to ask specific questions. What do these numbers mean? Should I consider other tests? What are the next steps? If the doctor seems evasive or rushed, do not let it go unnoticed. Insist on a follow-up appointment or seek a second opinion. The patient's health is undoubtedly worth the extra effort. 2. Do you really want to go through all that at your age? The question, do you really want to go through all that at your age, is profoundly insidious. It's cloaked in benevolence, but saturated with condescension. When a doctor asks this, they are not genuinely inquiring about the patient's preferences, life goals, or physical resilience. Instead, they're making a snap judgment based solely on the number of years lived. This is medical ageism in its purest form, and unfortunately, it is alarmingly prevalent. Over decades of medical practice, I've witnessed this question erode patients' confidence, diminish their hope, and strip them of potential opportunities for improved health. As an illustration, consider a real example. I once observed a woman named Margaret, an energetic 72-year-old who walked 2 miles every morning, tended a thriving garden, and hosted a weekly book club. She suffered from severe knee arthritis, making every step painful. Yet, her spirit remained unbroken. She consulted an orthopedic surgeon about knee replacement, a procedure that could restore her mobility and significantly alleviate her pain. However, instead of discussing the risks and benefits of the surgery, the surgeon sowed a seed of doubt, asking, "Do you really want to go through all that at your age?" with a tone full of hidden implications. Margaret left the appointment doubting not her health, but her own worth. Was she too old to deserve relief? Was her pain something she should simply accept? When she came for a second opinion, hesitant and deflated, it was infuriating. Margaret was an ideal candidate for surgery. Her heart was strong, blood pressure well controlled, and her active lifestyle suggested a high likelihood of successful recovery. Yet, that single question made her feel that her age disqualified her from a better quality of life. I have reviewed the relevant data. Studies show that knee replacement in healthy older adults can improve mobility and reduce pain in over 80% of cases, with many patients successfully resuming their favorite activities. Margaret decided to have the surgery, and within 6 months, she was back to her morning walks, pain-free and beaming with pride. Such ageist rhetoric is not merely upsetting, it poses a real danger. Research from a National Institute on Aging indicates that older adults who encounter medical ageism are less likely to seek treatment, adhere to medical advice, or even seek medical care in the future. Doctors who ask this question often operate from an unconscious bias, assuming the patient's best years are behind them. They make internal calculations based not on the patient health metrics, but on stereotypes. 70 means slowing down, 75 means settling for less, 80 means why bother. However, the patient knows better. Age does not define dreams, resilience, or the capacity for healing. If a doctor ever asks this question, stop them immediately. Say, "Yes, I want to go through this because I value my health and my future." Insist on discussing the risks and benefits based on your medical condition, not your age. Demand specifics. What are the success rates for this procedure in patients like me? How will this impact my daily life? If the doctor cannot provide evidence-based answers, it's time to find a new specialist. One who sees you as a person, not just a number. You are not a burden, and you deserve a doctor who champions your right to live fully, not merely exist. 3. Have you considered just letting nature take its course? This question strikes a deep blow, often delivered in a calm tone, accompanied by a sigh of false wisdom or an air of philosophical finality. When a doctor suggests, "Have you considered just letting nature take its course?" it might seem like an offer of a profound, almost spiritual perspective. However, Do not be swayed by this soft delivery. More often than not, this question is a ploy, a way for the doctor to avoid the meticulous work of explaining available treatment options, discussing risks, or advocating for therapy. And most alarmingly, it is disproportionately directed at older women, as if their lives are somehow less valuable to fight for. Let me be clear. In the context of true palliative care, when a patient is terminally ill and comfort is the priority, such a conversation can be entirely appropriate. However, too often, I've seen this question used prematurely, when viable treatments exist and the patient is far from the end of their life's journey. Allow me to share a case that still resonates deeply. Eleanor, an 82-year-old woman, was diagnosed with early-stage breast cancer. Otherwise, she was remarkably healthy, actively volunteering at her local library, playing bridge twice a week, and living independently in her cozy apartment. Yet, her attending physician, looking at her age, suggested, "At your age, perhaps it's time to let nature take its course." Eleanor was not offered a referral to an oncologist. She wasn't told about lumpectomy, a minimally invasive surgery with a high success rate and quick recovery for early-stage cancer. She wasn't even given the chance to weigh her options. The doctor's recommendation was not based on her prognosis or her wishes. It was based on the assumption that her life was nearing its natural end. When Eleanor came for a second opinion, bewildered and frightened, I spent over an hour with her. We meticulously reviewed her scans, discussed survival rates, over 90% for her stage with treatment, and explored her values. She chose surgery, recovered quickly, and 5 years later, she is still thriving, teaching her bridge partners a new trick or two. This is not an isolated incident. Data from the American Cancer Society shows that older women are less likely to receive aggressive breast cancer treatment, even when they are healthy enough to benefit. The phrase, "letting nature take its course," often masks a doctor's unwillingness to invest time or resources in a patient they have mentally written off. This is a betrayal of trust and robs the patient of their autonomy. A person has every right to decline treatment, but that decision must be informed, not coerced by a doctor's bias or sugar-coated platitudes. If you hear this question, do not nod politely. Challenge it. Ask, are you saying there are no viable treatments left? What would you recommend if I were 50? Or is this advice based on medical evidence or your perception of my age? These questions force the doctor to justify their stance and often reveal how well-founded their recommendation is. If they backtrack or cannot provide clear answers, seek a second opinion immediately. 4. Who makes medical decisions for you? At first glance, this question might seem innocuous, especially if you arrive at a doctor's appointment accompanied by a spouse, child, or caregiver. It might appear that the doctor is simply clarifying who is involved in your care. However, there's a crucial observation most patients never consider. This question can be a subtle test, and how it's asked or the assumptions behind it can reveal far more about the doctor's mindset than about you. When a doctor asks, "Who makes medical decisions for you?" they might be doing one of two problematic things: assessing your mental acuity without explicitly stating it, or looking for someone else to defer responsibility to because they don't fully respect you as the decision-maker in the room. Both scenarios are deeply concerning and can have long-lasting repercussions. Let's break this down. First, the doctor might be testing your cognitive abilities under the guise of a routine question. A slight pause in recalling a medication name, a moment of hesitation, or even the presence of a family member can trigger a doctor's assumption that you're not capable of making decisions independently. Instead of conducting a formal cognitive assessment, such as the Mini-Mental State Exam or the Montreal Cognitive Assessment, they rely on snap judgments. This is not only lazy but dangerous, as it bypasses scientifically validated protocols. Second, the question can signal a lack of respect for your autonomy. By asking who makes decisions, the doctor might be looking for someone more reliable to address, effectively sidelining you. This is particularly prevalent among older patients, especially women, who are often stereotyped as less assertive or capable. Let me share a story that still causes pain. Eleanor, a 76-year-old patient, came for a routine checkup accompanied by her daughter, who drove her due to icy roads. Eleanor was a fiercely independent woman. She managed her medications, balanced her checkbook, and cooked elaborate Sunday dinners for her family. However, during the appointment, she hesitated for a moment when asked about the exact dosage of her blood pressure medication. The doctor seized on this moment, turned to Eleanor's daughter, and asked, "So, do you usually help her with medical decisions?" In an instant, Eleanor became invisible. The rest of the appointment, the doctor directed all questions to the daughter, ignoring Eleanor's attempts to speak and interrupting her concerns about a new symptom. By the end, Eleanor felt stripped of her dignity, relegated to a bystander in her own health care. Here's what most patients don't realize. This moment doesn't end in the doctor's office. Once a doctor forms an impression of cognitive impairment or dependency, however shaky the evidence, they often document it in your medical chart. Notes like cognitive issues noted, impaired judgment, or requires family involvement can appear without your knowledge or consent. These entries create a paper trail that follows you, influencing future treatment, insurance decisions, hospital protocols, and even legal matters like guardianship. A 2023 study published in the Journal of the American Geriatric Society found that vague or unsubstantiated chart notes about cognitive decline were present in up to 15% of older patient records, often leading to inappropriate treatment limitations or referrals. In cases where a patient genuinely needs support due to dementia or cognitive decline, the conversation about decision-making is necessary, but must be transparent, respectful, and based on proper testing. It should never be triggered by a single pause, gray hair, or the presence of a family member. Unfortunately, ageist assumptions often drive these interactions, and women suffer disproportionately. Research indicates that older women are more likely than men to have their autonomy challenged in medical settings, even when their cognitive functions are intact. So, what should you do if a doctor asks this question? Take control of the situation immediately. Respond confidently. I make my own medical decisions, but I value my family's input. Is there a specific reason you're asking? This answer asserts your authority while inviting the doctor to justify their question. If they continue to address others instead of you, point it out, I'd prefer you address me directly as I make the decisions about my health. After the visit, request a copy of your medical records to check for inaccurate notes, and if found, demand a written correction. If the doctor continues to undermine your trust, find a new specialist who respects your autonomy. You are the captain of your health care, and no one should take the wheel without your explicit permission. 5. Are you still driving? At first glance, this question seems innocuous enough. Driving is a routine activity, and doctors sometimes need to assess it, especially if a patient has conditions like epilepsy or severe vision loss that could impact safety. However, here's the catch. The context and timing of this question can reveal something far more insidious. If you're seeing your doctor for an unrelated issue, say a blood pressure check, arthritis management, or a skin rash, and they suddenly ask, "Are you still driving?" it's time to be on high alert. This question might not be about your driving ability at all. Instead, it's often a covert way to screen for cognitive impairment, assess independence, or evaluate decision-making skills without being transparent. It's a test you didn't sign up for, and its results can haunt you. Doctors may use this question to gauge your memory, spatial reasoning, or self-awareness, assuming your driving habits reflect your overall mental state. The problem is they rarely explain what they're doing. If you answer yes, they might note in your chart, "Patient still driving, possibly unaware of limitations." If you answer no, they might write, "Loss of independence. Monitor for further decline." Regardless of your answer, it can be twisted to fit a narrative of frailty or impairment, often without any formal tests to back it up. This is particularly prevalent among older patients, especially women who face stereotypes about aging and competence. Let me give you a real-life example. Clara, an 80-year-old patient, was sharp as a tack, actively volunteering at her community center and expertly managing her finances. She came for a second opinion after a routine visit with her previous doctor left her shaken. During a discussion about her arthritis medication, The doctor casually asked, "Are you still driving?" Clara explained that she drove during the day, but preferred not to drive at night due to glare from oncoming headlights. The doctor nodded, but later, Clara's insurance company contacted her, citing concerns about her driving ability noted in her medical records. The note read, "Surprised patient is still driving. Monitor for cognitive issues." Surprised? Why? Because Clara was 80? Because she wore glasses? Because she made a reasonable decision to limit night driving? This single question, asked out of context, triggered a cascade of negative consequences, including a costly driving assessment she absolutely did not need. This isn't just about one patient. A 2022 report by the American Medical Association highlighted that older adults are often subjected to inappropriate driving-related screening in healthcare settings, with women over 75 facing disproportionately frequent questioning. These notes can lead to serious repercussions. Reports to state motor vehicle departments, license restrictions, or even legal discussions about guardianship, all without a diagnosis or standardized cognitive assessment. In some states, a doctor's report can trigger a mandatory driving test, even if the concern is based on ageist assumptions rather than evidence. The deeper issue is what this question represents. It's a societal bias that equates aging with decline, subtly seeping into your medical records and undermining your independence. Driving isn't just about getting from point A to point B. It's a symbol of autonomy, and challenging it without cause can feel like an assault on your personal freedom. So how do you respond? Be direct and proactive. Say, "Yes, I'm driving and I'm confident in my abilities. Is there a medical reason you're asking? Or is this a routine question?" If you don't drive, explain why on your own terms. "I prefer not to drive because I use public transport, but I am fully independent in my daily life." Then ask, "Will this be noted in my chart? And if so, how?" Request a copy of your records to ensure no misleading comments have been added, and promptly correct any inaccuracies. If the doctor's tone or subsequent questions feel dismissive or judgmental, trust your instincts. Seek a specialist who assesses you based on your health, not stereotypes about your age. Your independence is something you must protect, and no one should undermine it with a seemingly harmless question.